The vaccine administered today was developed by the National Institutes of Health in record time after the new coronavirus exploded from China. We'll be right back. Local healthcare providers continue to step up efforts to make sure that we have the supplies needed to care for those who get sick from coronavirus. And here to tell us what's being done locally is medical reporter Liz Bonis. Hey, Liz.
Hey, Kyle. Hello to you again. And hello once again. We are welcoming Dr. Kevin Joseph in our newscast this evening. He's the Chief Medical Officer at TriHealth, joining you today because we've been following what's been happening with your team quite a bit. You opened up more testing sites, I know, and you began seeing patients all over the tri-state at risk for coronavirus, even within the last few weeks. Now, they know that they will need to reallocate resources, but they're also literally redirecting people. Listen to this.
We've created alternative ways to get people in and out of the building. Good Sam actually went from visitors, we went from probably 40 different entry points to 2.
Wow. So where are they?
To 2. There's one outside of our Clifton entrance off of our blue elevators on the 5th floor, and then the Dick Smith lobby.
That's Jamie Easterling from your Good Samaritan Hospital location. So what were you trying to do? You went from, what do you say, 40 to 2?
Yes. So as we all can imagine, there's very sick patients inside the hospital. They have immunocompromised systems, and if they come in contact with this virus, it could be very deadly for them. So that's one aspect. The other aspect is what is a real risk to our whole community in healthcare is to not have healthcare providers. And if we do that, we won't be able to take care of the patients with COVID-19, as well as heart attacks, strokes, any other issue. So we also need to protect our caregivers. So the way we're protecting our patients and our caregivers is to narrow down the entrances that people can enter, and also limiting those who can actually come into the hospital. Right now, most of the healthcare systems are saying there's unfortunately not going to be any visitors, with exceptions if there's a laboring mother or if there's a dying patient. And that is for the benefit of the patients as well as the team members, to make sure that healthcare system locally can continue the need of the community.
And we were over there today. We have a little video to show you. You are so serious about this that even when you do have to bring patients in, look how far apart I'm sitting there. Those are what your waiting areas are now like, because
the best ways to prevent yourself from getting this illness is, one, good hand hygiene. And we talked about that earlier, and cleaning your cell phones and other things that you come in contact with. Don't touch your face, because anything you touch your face, that could be a carrier. The other aspect is just clear distance. Over 6 feet is very helpful, and the less individuals you come into close contact with, the less chance you are to catch this illness.
Yeah, no question. We can see it there. You guys are doing a great job. We're back in our next half.